If you have an anemic kitten from neonatal isoerythrolysis, you want to take the kitten off of the dam as soon as possible. See if they get more anemic and see if they're developing that, or maybe they're just going to lyse themselves and be okay. But if they are getting more anemic, you may need to intervene. And if they have parasitism, you also might need to intervene with a blood transfusion. So typically when the PCV is below 15%, we're going to go ahead and intervene and make these guys feel better and feel stronger. So the best way to figure out the amount is to do their desired PCV minus the current, divided by the donor PCV, times 100, which is the mils per kilogram of body weight or of blood volume for these guys, and then by their weight in kilograms, and that gives you the amount to use. And you just go ahead and calculate that, and then you can go ahead and give the blood product. Blood products typically are going to be whole blood for cats, and if the kitten is greater than 3 days old, you should blood type the kitten and make sure you're giving a type A kitten type A blood and a type B kitten type B blood. And it only takes about 3 drops of blood to do that, so that's why we're in okay shape with these guys, even at that young of an age. If they have neonatal isoerythrolysis, and it's the first 3 days of life, you can still use the mother's blood, and the good thing is she won't react against her own blood, so that's actually great. But after 3 days, the kitten can potentially start to make their own antibodies, so we want to use the correct blood type for the kitten. And any kitten that's less than 3 days old, you can use the same blood type as the mother. It's fine. Okay. Transfusions go over 1 to 4 hours, and you just obviously, just like an adult, make sure they're not having a transfusion reaction. And you can give the transfusion either intravenously or intraosseously. Okay. I think we just did this twice in a row. We're going to quickly go through this here. Hold on. Sorry. And one more. On to the next slide. Here we go. Okay, now if they have failure of passive transfer, they should receive their colostrum within 18 hours of birth. So if you have an orphan kitten who has no mother or something of that nature, this is a big problem. And so you want to make sure they're getting colostrum as soon as you can. So if you have another mother cat who's lactating, go ahead and you can use her, but she has to have, just given birth recently, or in the next slide we'll talk about what you can do. But remember, any kitten who has failure of passive transfer is at risk for infection until they're about a month old because of the concerns with their immune system. So if you have failure of passive transfer, you can give serum from an adult cat with the same blood type to that kitten. And usually it's 15 mils of serum per 100 grams of body weight. And you can give that subcutaneously, divided up into 3 injections. So you spin the blood down from the adult, figure out how much that you need, and go ahead and give it divided into 3 aliquots, 1 aliquot given every 8 hours. And they'll absorb the antibodies from that and be in good shape. Okay, a couple quick words on monitoring so we can get to our questions. So basically, if you've done any interventions in a kitten, no matter if it's just feeding, just treating dehydration, just deworming them, whatever the heck you're doing, just giving them a blood transfusion, we can go ahead and do some serial monitoring. And one thing I would check is PCV, because if we're giving fluids, we're deworming them or transfusing them, anything of that, they're having isoerythrolysis, any of those things are reasons why their PCV can go down. So if you've transfused them, wait a couple hours after the transfusion and check their PCV, and then check it about once a day. And the reason we don't want to check more often is because of the us causing anemia by blood draws. If their dehydration, if they were dehydrated to start with, or you suspected they were, it's tough in a neonate because the physical exam findings differ from an adult to tell exactly how well you're doing. And their specific gravity of their urine, they don't really concentrate to start with, so it's hard to follow that serially. But what you want to look for is make sure their specific gravity of their urine is well less than 1017, because that means we want it to be 1006 or below, because we're giving plenty of fluids that are just being flushed out the kidneys, and that's okay. And just make sure they're urinating frequently and regularly in decent amounts. And if they're not urinating enough, it could indicate that they're dehydrated. Also, body weights is like your biggest thing that you can monitor in these guys, and serial body weights are very, very important because they need to be gaining weight. And if they're not gaining weight, we're either not feeding them enough or the animal is getting sicker. And so just pay really close attention to that. And if they're gaining weight, we have a pretty good feeling like maybe this little guy can pull through. If they're not gaining weight, we may be in trouble. Stool color is very important also. So normal stool should be a beautiful pasty yellow tan color. If we're overfeeding them, it may be watery, more yellow or green, and that's bad, so stop feeding them so much. If it looks white, they could have liver disease or some kind of enzyme deficiency where they're just not able to utilize nutrients correctly. And if it looks bloody, worry about things like coccidia, sepsis, something of that nature, because any of those things can cause some bleeding into the colon. And make sure these guys are behaving like they should be. So they should be, moving around, making some little kitten noises, rooting around, trying to move to the heat and knot. And if they're not doing those things or any of the stuff you expect to see in an older kitten, then something is probably wrong with them. And you need to kind of look again at them and see what's going on.